Hello everyone, you are watching Blackboard. As we have discussed about the causes, types, symptoms, risk factors, complications of diabetes in our previous episode, so today we're going to talk about diagnostic criteria, clinical or lab findings, treatment plans, and a bit about the future of diabetes mellitus. So, what comes to your mind when you hear about diagnosis of diabetes mellitus, or commonly known as blood sugar testing? A. Fasting blood glucose levels. A. Random blood glucose levels. An oral blood glucose tolerance test. Or an HbA1c test. Let's pile up all these queries and confusions in a proper manner. So if you are facing symptoms of diabetes, then you can get yourself tested for fasting blood glucose levels. Remember, fasting should be of 8 to 12 hours overnight and get the fasting blood glucose test the very next morning. If the fasting blood glucose levels are from 70 to 99 milligrams per deciliter, then the blood glucose levels are normal and you don't need to worry about it. If the blood glucose levels are greater than equals to 126 milligrams per deciliter with more than one occasion, means more than one reading should be taken to confirm, then it is labeled as diabetic. But did you know if blood glucose levels are between 100 to 125 milligrams per deciliter, it is labeled as pre-diabetic condition, which means you need to take serious attention because it can develop into diabetes later on. Or there can be a second option for the testing. There can be a random blood glucose test. Now, if the results of random blood glucose levels are less than 140 milligrams per deciliter, then it is considered normal. If the results are greater than equals to 200 milligrams per deciliter, it is labeled as diabetic. But if it's greater than 140 but less than 200 milligrams per deciliter, it is considered as pre-diabetic. Or there can be another option. That is, you can have an HbA1c levels instead. HbA1c is basically the glucose that is associated with the hemoglobin of red blood cells. HbA1c levels are more reliable for monitoring the long-term diabetic controls than the random blood glucose levels, because it gives the picture of patients' blood glucose concentrations over the past 3 months. If the levels of HbA1c are less than 5.7%, then it is normal. If it is greater than equals to 6.5%, then it is labeled as uncontrolled diabetes mellitus. But if it's in between 5.7 to 6.4%, it is labeled as pre-diabetic. But keep in mind, you really don't need to have all these 3 tests at a time, because any of these 3 can be fruitful if tested properly. So shortly, you can have any of these 3, a random glucose level or a fasting glucose level or an HbA1c test for the diagnosis of diabetes with random and fasting glucose confirmed at more than one occasion. Then what about oral glucose tolerance test? The oral glucose tolerance testing is done for the ones who are pre-diabetic. So before the oral glucose tolerance testing, your blood sample will be taken. Then you will be asked to drink a liquid containing 75 grams glucose. Then your blood sample will be taken every 1 hour after drinking the solution. If your oral glucose tolerance test levels are less than 140, it is normal. If it's greater than 200, it is diabetic. But if it is in between 141 to 199, it is labeled as pre-diabetic. Now have a look at the other lab findings of type 1 diabetes. In case of type 1 diabetes, there is an increased blood ketone levels, which leads to acidosis, which means a low blood and urine pH, which ultimately leads to an electrolyte imbalance like low sodium, high potassium, and low bicarbonate levels, along with an increased plasma and urine glucose levels and an increased serum and urine osmolality. Let's have a look at the lab findings of type 2 diabetes. Actually, type 2 diabetes is characterized by a non-ketotic hyperosmolar coma. There will be an increase in the serum and urine osmolality, an electrolyte imbalance, including low sodium, high potassium, and low bicarbonate levels, and serum glucose levels exceeds up to 300 to 500 milligrams per deciliter. Keep in mind that ketoacidosis, that is blood ketone levels, are high in case of type 1 diabetes only. Now there can be a number of treatment options available to help manage and treat your diabetes, but because everyone is different, so the treatment will vary depending on your own need. Generally, for type 1 diabetes, since your body can't make insulin on its own, so insulin is taken in the form of injections. For type 2 diabetes, mostly and initially, oral insulin, most commonly known as metformin, is the common medication. Other options include insulin pumps, diet management and exercise, weight loss strategies, and emotional support. Now it's question time. Will there be any cure for diabetes in future? Sadly, there is no cure yet, but scientists are working on a groundbreaking weight management strategy to help people put their type 2 diabetes into remission. Now drop your knowledge about the future of diabetes down in the comment section, but don't forget to like my video and subscribe my channel. Till then, bye!